Thank you so much, everybody. So we people will join us again.
मोनोक्रॉन है क्या? मैंने ठीक है।
Sir, Dr. Tiwari is joining.
हाँ, टाइम टाइम खत्म हो गया तो फिर से कर रही है दोबारा स्टार्ट।
लोग लंबा जो समय बताया हुआ है, ये लंबा लंबा लिखते बनाता है। हाँ।
सनी सर ने ज्वाइन कर लिया है.
Yeah.
Sir, you can continue.
आ रहा है?
हाँ, आ रही है आवाज. आवाज आ रही है.
और हमारा स्क्रीन आ रहा है कि नहीं?
नहीं, स्क्रीन अभी नहीं आ रहा है.
अच्छा,
सर स्क्रीन शेयर ऑन कर लीजिए भाई, थर्ड ऑप्शन से.
स्क्रीन शेयर
टर्न स्क्रीन शेयर ऑन.
तो अभी दिखता नहीं. 1 मिनट.
सर इट्स विजिबल.
अभी
हाँ जी सर, क्लियर है.
ठीक है.
फुल स्क्रीन कर लीजिए.
हाँ ठीक है.
हाँ जी, फुल स्क्रीन कर लीजिए.
Okay, so you can see, you can listen. Can you listen and see?
Yeah, you are audible, sir.
Okay. So we were discussing about that case where we have the cause and effect phenomena and the symptoms as a result of anxiety and emotion. So we have come to conclusion that what is available in the case was the cause, complaints, modalities, mental state, and concomitant. And then we have decided that this will be a better case if we go by bogus method. So we have taken this rubrics: emotion aggravates as a causative modalities, emotions, fright, anxiety aggravates as a causative modalities, exertion, mental aggravates as a modality, exertion, physical aggravates as a modality, menstruation, constipation before as a concomitant, menstruation, constipation during as a concomitant, cold taking and its effect, sensation and complaints, that is chapter in Boger, and joints, inflamed, sensation and complaints in general. So these are all rubrics we have taken, which covers the whole thing about disease and patient. Then we have done repertorization, and we have got Nux vomica, we have got Silesia, we have got Pulsatilla and Bryonia. So the final thing is we have to have analysis of the result depending on the other picture of the patient. Medicines came prominently are Nux vomica, Silesia and Pulsatilla. Nux vomica basically ruled out because the patient has never got angry as per the parents' statement. And also, Silesia cover a little more points. What is that? Emulsion by sun and white spots on the nails. So she was prescribed Silesia. She was staying far, so she was given medicine for a month. And seeing the pathology and sensitivity, she was prescribed Silesia 30 once a week with placebo pills. Then she was asked to report after a month with blood checkup. Symptoms are like, see, all joint pains are better. She can write, she can do homework. She is able to ride bicycle, which she was not able to do so far. Constipation better. Menstrual pain and constipation during menses much better, but was present. Feeling general tiredness after school was there. She was prescribed Silesia 200 single dose with placebo. And this is the result. You can see RF factor has become much less, 8.8. Up to 20 is the limit. And ESR has come down to 17. And patient has no symptoms. So patient is cured. This is the last case, second case of chronic. This is Mrs. FK, 35 years reported. This is a case last week we have dealt with. So I just prepared it in a hurry, but everything is there. 35 years old reported for the treatment of severe dysmenorrhea on 18th July. She reported first. She is married for 14 years and have not conceived so far. Her periods are regular but very painful. The patient and the party were telling, even if she is not conceived, it's not a botheration for her. But her pain every month is causing so much problem to all of us. So first, doctor, treat the pain. So this was a very, same verbatim I have told you what patient has told. So it was very painful period. She suffers badly during the periods. She is not relieved of pain by any oral painkillers and has to be given some injections for first 2 days. Recently, she was diagnosed to have an ovarian cyst. And the obstetrician and gynecologist said, if you want cyst. So she was advised to undergo operation in order to get relief from the pain. But she does not want to undergo any operation as she still hopes that there will be pregnancy. And if she undergoes operation, it may interfere. So this is the report she has come with. This is 10th July report. And if you see the impression, large ovarian cyst right side. Brief description about the patient. She is thin-built, housewife, stays with in-laws and husband in a joint family. Got married at the age of 21 years after completion of her degree. Wanted to work as a teacher but could not do so because of the family background, as no female are allowed to work in that family. She feels difficult to pass time as husband goes for work in the morning to a long distance and returns late. She feels unfortunate herself because she could not conceive, whereas other co-sisters are having children. She has two co-sisters having 4 and 3 children respectively. Her menstrual history is menarche 13 years, regular menses with 5 to 6 days bleeding with mild pain for first day. This is earlier. Her menses became painful after her marriage, when with each menses she was expecting to be pregnant, because each menses she was thinking, oh, this menses I may not get and I will become pregnant. So it used to be late, but whenever she was getting menses, it used to be very painful because she was expecting something and actually happening something. Mentally also, she used to cry during menses because she did not want to get menses. For some years, it used to be late and painful. Slowly, she lost her hope of becoming pregnant, as she knows that problem lies with the husband's sperm count. Now the menses have become regular, but because it's not late, she has lost the hope and she doesn't wait for period. She doesn't wait that she will become pregnant. So periods are regular, but the pain has become too severe to tolerate. And some symptoms like before menses, mood swings, feels irritated, and a kind of fear that menses will appear and will get severe suffering. See, menses has become a terror for her, you can say, because whenever she thinks she's nearing menses, she thinks of those pains and sufferings. Very sad, does not want to talk that time. Then during menses, vomiting along with the pain mainly the right lower abdomen. Faints during menses, severe weakness, cannot even walk and talk, talks in symbolic language because he can't talk due to pain. Sadness 3 marks, increases amounting to depression. Character of menses is regular, profuse, dark, and clotted. It lasts for 4 to 5 days. She has aversion to food, salty, 3 marks aversion. Does not like vegetable. Desires sweets 3 marks. And all kinds of non-veg, especially fish and chicken. Hot patient cannot tolerate heat. Does not like to go in sun, even in the morning hours. sweat profusely and feels very uneasy with the sweat. She does not feel that she has any happiness. She does not feel that there is any happiness left in her life, and she does not get pleasure in anything which other family members enjoy, even with husband. She does not feel good in company, neither in sex. Does not like to do any work willfully, though she has to work whole day as housewife. She is very slow in thought as well as in mental and physical work. Sometimes she keeps doing things while others finish their work. She does not feel like going in any functions as everyone asks about children. She does not mingle with people and prefers to be alone and keeps thinking. She feels she is very slow in everything. She hates people, including her husband. Now, what is available in this case? See, we have got a lot of qualified mentals and we have got physical generals. So obviously, this is the totality. Sadness menses before, sadness menses during, indolence, aversion to work, indifference, pleasure to, aversion, salt, desire, sweet, faintness, menses during, vomiting, menses during. See, these menses symptoms are all general symptoms. Menses copious, dark, and painful. So we have repertorized this case, and we have got two medicines very close running is sepia and natriumur. After repertorization, two main medicines are coming prominently, sepia and natriumur. The following understanding about the patient helped to finalize the. It was really difficult to differentiate because sepia and natriumur, they go neck to neck in most of the symptoms. But few symptoms are really helping to differentiate. One is hot patient, then does not like sun, strong aversion to company and talking to people. So the medicine is clear, it's a natrum. See, initially when the case was being taken, one of my junior was taking the case. She felt that when there is a aversion to salt and craving for sweet, how can you give natrum? But this is beauty of repertory. You refer Kent repertory and you will find aversion to salt, natrum is also there. Craving for sweet, natrum also is there. So this will really change your understanding of medicine. So please refer repertory. Sometimes we have a little different understanding of materia medica, which will be clarified by repertory. So repertory is something which clarifies your points, make you more and more complete in materia medica knowledge. She was prescribed natrum 200 once a week. She reported after 3 weeks because that was the menses time. After the menses, bleeding for 6 days but not profuse. Pain was there but tolerable. This time she could avoid taking injection. This is one lifetime achievement for them, you can say, because they wanted to avoid injections every month. No vomiting, but nausea feeling was there. Could not eat anything. Feeling of sadness was less. Was lying whole day. Could talk to her co-sister. Her ultrasound was done on 3rd after 3 weeks, and it shows really the half size of cyst. It became from 6.4 to 6 into 6.2 to 5.3 into 2.6. This is the ultrasound where she has got right-sided ovarian cyst, but the size is less. She was once again given natrimum 200 for 3 weeks. Report after 3 weeks, menses regular, bleeding moderate, pain better, moods better. And this ultrasound on 2nd 9, this month only, shows no ovarian cyst. Ovaries are normal, everything is normal, but she has been detected a uterine fibroid of small size. And now, next I am planning, because natrum and sepia, they are complementary. So in due course, she may require CPR. This is another advantage of repertory. When the last group of medicine comes, they are very, very similar. And sometimes after one another, if they have complementary relationship, they will be required. So don't throw them out of the group. Now, what other use of repertory you have? To find the simillimum is one. Then as a reference book. See, in Boenninghausen's title of the Therapeutic pocket book, he suggested that a book needed for bedside and selection of medicine. I mean, study of materia medica. So, study of materia medica and bedside use, both are main use of repertory. So, study materia medica and find simillimum. So, study of materia medica also can be done by repertory, and beautifully it can be done. Like even our Frederik Sean was telling, symptom. Take like throat symptoms of lycopodium and go to the throat chapter. You find what are the symptoms are covered by lycopodium. It becomes throat symptoms of lycopodium. And you can have comparison also. Like make two columns, lyco and lycosis. And each symptoms you go on writing, you will find one picture and another picture. And you can go on comparing. There may be emulation by same factor, but there may be variations in markings. So this is a beautiful study. So as a reference book, no doubt we have referred so many things. In a study of materia medica, study of a drug we can do, study of comparative material we can do, study of intensity of symptoms we can do, which not found in one materia medica book. Because repertory is taken from mostly all the materia medica. So you find all information at a place. What is the beauty of this? You can understand. Everything is there in front of you. That is repertory. It helps to find a complete symptom, which materia medica may not give you at one place. It helps you to formulate a question because you are aware of what is available in our repertory, what modalities available, what concomitants are available. So you can have your questioning, your case taking in that direction. Then constant use improves your knowledge of materia medica. Constantly, if you use, you remember, oh, this is symptom is there in Kent. Oh, natrum has aversion to sweet. Natrum has aversion to salt. This you can understand, improve your knowledge of materia medica. See, a long time I was referring anticipation rubric from Kent. And anticipation means the anxiety before attempting anything, like anticipatory anxiety. And long time I was not prescribing natrum because it is not given there. And in materia medica also anticipatory anxiety is not given in natrum. But in one case I was seeing all symptoms. So because of this single symptom, how to remove natrum? Then I decided to refer other things. And there is a book, Boger's Correction to Kent's Materia Medica, Additions to Kent Repertory by Boger. In that, under anticipation rubrics, he had added natrum mure. So if you want to study completely Kent's repertory, use this companion, Additions to Kent Repertory by Boger. It's a very authentic book. So now anticipatory anxiety, even natrum has got. So this is improving our materia medica knowledge. So repertory and repertorization is gem in homeopathy. You cannot do without repertory and repertorization. If you want to achieve something good. If you don't want to achieve, just to have a formal practice, then it may not be required. But who do not want to achieve everything? So it's required. Formulating question, then constant use improves materia medica. Second prescription, like I was telling, the group of medicine which comes at the end, keep it for further reference. You may get some complementary, some second prescription medicine. Source of symptom nowadays, you find most of the repertories they are giving source. They are putting one number and you have to refer and find out where from you have got. Synthesis of new rubric you can do. Conclusion. Now what we got from this presentation. what we got from all this discussion, what is the conclusion? Every homeopathic physician should expertise himself or herself in art of prescribing by emphasizing on repertorization. This is the only right way to therapeutics. And please don't be misguided by many people who are telling you use only delusions, use only dreams, use only observations, use only this mode, that mode. Don't use single thing, use the totality, and totality is always advocated by repertory and repertorization. So go for totality, go for repertory. This is the only right way. Art of prescribing is learned by applying the principles into practice without violating norms. Sometimes people say, in homeopathy, theory and practice is different. No, not at all. You apply all the principles, all the theory, that is only practical things. The more you are theoretical, more you become practical. That is in homeopathy. Follow the guidelines given by our stalwarts. Don't compromise. There is no shortcut in learning, especially when it comes to the learning of practice of medicine. Practice of medicine means not the subject. Practicing materia medica into your prescription. Whether it is repertorial or non-repertorial, mechanical similarity will lead to failure. Sometimes, we tell students to, for exam, collect 30 cases and repertorize. Most of them are mechanical. So what they learn is wrong things. Ask them, the whole year is there. At least 1 or 2 cases in a month. Do it proper. Don't do mechanical things. And sometimes you find, we take the case and we go on writing on a screen each symptoms, and then finally tuck and refer the computer. That's all mechanical way. Unless you refer characteristic, you cannot get a good medicines. Like our Pandey was telling, if you feed something kachra only will come out. Feed something good, feed characteristic, the good remedy, the similimum will come out. Repertorization done properly leads to constitutional, miasmatic. See, all kind of things come out from repertory. You don't have to do anything else. Only repertorization, because those symptoms represent miasm. Those symptoms represent constitution, represent the chronic totality. So what comes out covers everything, covers constitution, covers miasm, covers totality. And finally, the need of repertory comes from character of homeopathy itself. See, this is Barthel and Winnankar. They are author of Synthetic Repertory. They have said that need of repertory comes from character of homeopathy. See, character of homeopathy is a logic and logical way going about from case taking to selection of medicine is repertorization. So the need of repertory comes from the character of homeopathy. And if you don't want to spoil the character of homeopathy, you have to follow repertory. There is a need. This is Gentry statement. There is a need, and it may be truthfully said, an urgent demand for a repertory which will enable the physician to find quickly, certainly, and desired symptom in materia medica together with indicated remedy. The proper use of repertory is indispensable. See, those people were great people, but still they say that repertory is required. And sometimes we feel not required because we are not properly going. So the proper use of repertory is indispensable to the prescriber, especially in complicated and difficult chronic cases. Here also he is telling where it is indicated, where not indicated. The materia medica is so vast that it is not possible to carry it all in memory, nor it is considered by experienced prescriber. So repertory is must. And the final say, you do not have a choice. You do not have a choice other than following a right path. So what P.R. Smith is telling, no one can know everything. And that is why, in all honesty, one must admit that no consensus homeopathic doctor can practice homeopathy in a serious and really scientific way without a report. To meet the challenges of exploding materia medica, the homeopathic repertory was born. I don't have to explain this. This is a very, very clear statement made by P. Smith that you have to have repertory because you do not know everything. And for a conscientious homeopathic doctor, you should have information in order to find a minimum. And that is the last statement I also make. Repertory is must. You don't have a choice if you want to go logically for a prescription. Whether you do it mental repertorization, referential repertorization, or systematic repertorization is must. That's all I wanted to say. Thank you very much. So I come to an end.
Thank you, Dr. Tiwari, sir.
Yes.
It was a mesmerizing speech, and I am happy that all delegates are mesmerized with your very unique presentations on the whole. And
Sir?
you will be.
Sorry to interrupt, sir. Dr. Tiwari, sir, you can come back to Google Chrome.
I have come back again. I have already there.
You can. Yes, sir. I stopped the screen share. You can come back to the Google Chrome.
I have come back actually.
Sahani sir,
I can see Dr. Sahani.
Okay, sir. Okay.
Okay.
Yes, sir. Tell.
Dr. Jessica, is there any questions on the chat box?
Sir, actually, because of the new session, it was started. No, the questions I'll tell you previous ones. Okay. What? Wait, just give me a minute, sir. How do lexical hypotheses related to homeopathic repertory?
See, this is out of topic. I don't want to discuss much. Next question.
Sir, there was one more off-topic question if you want to discuss or not from Dr. Thomas about Hart's method for finding out the genus epidemicus during epidemic outbreak.
No, that is also not I'm going to discuss.
Okay, I will just search for more questions. No, sir, there were no more questions.
Okay.
Yes, sir. I want to request if still somebody who have any queries, I'll just check the YouTube also, sir, once.
Yeah, if you have a question on repertory, repertorization, methodology, then I am ready to answer.
Sir, I think there is a question from Dr. Upendra. Pus cell in urine 4-5 cells with frequent desire to urinate. Desire to urinate, uncontrolled situation at night. How we can repertorize? I think he wants to know.
See, tell him to get some more details and then only repertorize. This is just referring one symptom, that's all. So go to urination chapter and find out this is there in the bladder in Kent repertory. Frequent urination and night. That rubric you can see. But for repertorization, he needs more symptoms. Yes, sir, finish it.
Sahani sir, I feel there are no more queries, sir.
I think Sahani is not listening.
Yes, sir. Sir, refresh your page once, Sani, sir. Maybe your internet issue. Sani,
Dr.
sir.
Sahani, can you see me? But I
Yes,
can
he'll
see
be
him.
back. Yes, sir. He'll be back. He'll be back in a minute. Yes, he's back. Sir, please on your video also, Sani, sir.
Yeah.
Yes, sir. Sir, there are no more queries.
Thank you, Jessica ji. So now we have come to the conclusion part of this webinar. The 2-day webinar was wonderful and very wide coverage were there. And last but not the least, Dr. S.K. Tiwari sir has completed, and he has included all the 2-day programs within himself. So your talk are very wonderful, sir. I thank you and express my thankfulness from the core of my heart and on behalf of the Homeopathic Science Congress Society and Jain Homeopathy 360. Sir, now as a concluding remark, and I have to only say that our society, Homeopathic Society, Homeopathic Science Congress Society, has been constantly working for upliftment and upgradations and keeping the homeopath connected with the scientific aspects of the homeopathy. It was founded
It's not audible.
Sir, please refresh once, Sani, sir. Sir, I think his technical issue is there. Sir?
with the inspiration of Dr. B. Sahani himself, homeopathy. Sorry, I was got disconnected. So the subject of the repertory has occupied the most prominent.
No, again some problem.
Sir, your audio is gone. Sani, sir?
Position in the teaching field with
Now it's
the
fine.
No.
Hanji, sir. He's joining again, I think.
okay. So, Dr. Jessica, I see her so much enthusiastic about this webinar and just uniting all the homeopathy together. So this is a great contribution from the young student as well as the practitioner as well as the editor and everything for the homeopathy. Dr. Jessica, we are proud of you, and I'm from the core of my heart, I have blessings for all best of your future also, and I hope that you will go to the peak of the homeopathy in coming time. And with this, I thank everyone for having a great patience and listening to this webinar. And definitely it is going to bring some change. We want some change. And our purpose that we shall keep working till the change is visible. It has to become visible to us. So with these words, I thank you all and I thank you all. Jessica ji.
Thank you so much, sir, for your motivating words, always motivating me and guiding me to do something better and unique. So it's all because of my senior homeopaths as well as my teachers, my colleagues that I am here, and all my juniors who have been supporting me always. Thank you so much for your support and everybody's support. I think we can end the session now. I'm very thankful to Dr. Tiwari sir, Dr. Jeetendra sir, and Dr. Pandey sir also for today's session. This was a great webinar, and like yesterday also we had great audience, and today also we had great audience. And for certificates, I want to inform everybody that you will be getting the certificates on your emails within 24 hours of this webinar after we end this webinar. So please be patient, and you'll receive certificates on your emails. Thank you so much, sir. Thank you so much, Tiwari sir. And we can end the session, sir. You
Yeah,
want to say
sure.
something?
No, I'm very happy that such things are being organized, even when things are not possible to meet personally. So things are being organized for the good of homeopathy, and it should continue because without sharing, it doesn't increase. It's called that no, Vidya is something which increases more and more when you share, and it dies when you just keep quiet. So I request all the people to keep sharing your cases, your difficulties, and discuss. And such a webinar being organized by Homeopathy 360 is really a welcome thing. And also, Homeopathic Congress has joined this. Bihar HMAI has joined. So such organization should come forward, and unitedly we should grow. I thank once again all the participants and the organizers for beautiful things organizing. And Yashika, I must thank you. First thing is your voice is very good and you speak well. So continue to do all the things with this good voice. Thank you very much.
Thank you so much, sir. I also want to update the audience about tomorrow's webinar series. We are starting a series tomorrow for all the postgraduate students. Although UG and practitioners can also join, but it is more research oriented. We are organizing a national webinar on postgraduate education in homeopathy by Homeopathic Science Congress Society, Homeopathy 360, supported by CCRH and all PG institutions of homeopathy. We'll be beginning the session from tomorrow to 27th of September from 11 a.m. onwards. If people want to register, I put the link in the chat box. You can register for the same. And also we'll be tomorrow's session will be chaired by Dr. Anil Khurana sir and Dr. Ramjee Singh sir, and the speakers would be Dr. Alok Mishra sir on utility of observation in homeopathic prescribing, and Dr. Mansoor Ali sir on effective literature review. So we have many upcoming doctors, many senior homeopaths, Dr. Nayak sir, Dr. Mohanty sir, Dr. Subhash Kaushik sir, Dr. Parth Prathim Pal sir, and many doctors, research scientists from all over the country we have gathered, Dr. Abhijit Chakma sir. So I request everybody to please join us in this webinar series also. Stay updated. Thank you so much, everybody.